Since the lockdown was removed, the regime has relied on a green health code as a pass for people to move freely in China. However, riots exploded in China due to the mistrust in the measure. Mr. Gao is a citizen of Hubei. He explains his grave concerns about the effectiveness of the green health code system to the Epoch Times.
You log on every day through the phone during the 14 days of isolation. It's like punching a time card. 14 days later, the code is green. When your surrounding area is free from any new infections, after 14 consecutive days, it's a pass. No one near you has the virus, and your code will be green. With a green code, it's a pass.
Is the health code on the cell phone a pass to travel inside China?
Yes, it is.
A man went back to Gansu with a green health code from Wuhan, but tested positive for the CCP virus. What do you think of that?
Well, this punching card system on cell phones is just a formality. It's not a laboratory test. It only tells you that this person has been checking in during the 14-day isolation. It does not say anything about those who were infected in your area. This code does not represent the rapid test. It serves as a roll call. You'll need a swab test and a CT scan to confirm the infection. The code does not serve any purpose of confirmation.
It's a fact that many places have adopted this health code system as a pass for travel?
It's been my concern. Many media and public officials talked about the turning point when the infection rate starts to come down. I've commented on this before. To get to the turning point where the pandemic is contained is almost impossible. First, there's no effective medicine. Second, there are not sufficient medical resources. Third, how much do we know about the latent phase and the suspect cases? In China, we don't know anything about the latent phase of the infection. This health code system has no binding capacity. It's just a routine roll call. I think this imposes a huge danger because cases are showing that the latent phase is getting longer. It's not only 14 days, it's tens of days, and even up to 40 days. It has become a hidden danger.
What the authority does is very irresponsible. Why is that?
It has always been irresponsible, always including concealing the facts. To justify its political correctness, they want everyone back to work. They want to keep up the economy. There's no sense of right and wrong. There's no concern for the public interest. They won't do anything to contain the pandemic unless it gets serious again. I have kept on stressing, no school until the pandemic is over. But look, many schools reopened. They don't care about the lives and well-being of the people.
Are you worried about another outbreak?
Another outbreak is unavoidable. Patients in the latent phase. Those released from makeshift hospitals. Those who were not cured. Those so-called cured but who turned positive again. They are all risk factors. The recurrence of the outbreak is very likely. Many people around this area have gone out. Rarely anyone still stays at home. I was just thinking of that. I might need to work and I should do a CT scan before I go out.
You will do the CT scan, but many others won't. You are still at risk of being affected.
It's really up to a personal understanding of the prevention. We hold our lives in our hands. We need to be responsible for ourselves. The safest place is where preventive measures are in place. That's how to gain a sense of protection. My landlord, for instance, does not wear a mask when he goes out because the lockdown has been lifted. But we were the epicenter. That is a considerable risk. In Shenzhen, a friend of mine said his company hands out 2 N95 masks a day. There's a temperature check, reports of the itinerary if you go out, a policy of frequent hand washing, and spacing in the dining center. That's a good prevention measure. In our Huanggang district, there's no sense of prevention. With the lockdown lifted, people are happy that life is back to normal. People think they have survived and feel relaxed. But what we need is to enhance the sense of intervention as this is the most critical point. It's dangerous now.